The MD-PhD program at the University of Western Ontario's Schulich School of Medicine and Dentistry is one of only two of a kind in Ontario. The program trains doctors to be proficient in research as well as the clinical side of medicine. Students come out of the program with an MD and a PhD. Today, as part of our multi-part medical research series, I met with one MD-PhD student who's researching the causes of osteoarthritis.
This tissue starts to break down, and you can see how roughened the surface is here, and we can also see that it's starting to wash out.
This is what the cartilage between the joints looks like under a microscope in a patient with osteoarthritis compared to a healthy joint.
This tissue will erode and erode all the way down to at the bottom here. You can actually see just a very little bit of the bone that the cartilage rests on, and this can obviously be very painful for the patient.
PhD MD student Tom Appleton is researching what causes this degradation of the tissue in osteoarthritis.
It's a disease that affects a huge proportion of the population, approximately 50% of the population over the age of 60. So there are a large number of people in Canada and obviously across the world that are affected by it.
Over the past few years, he's found that a protein called transforming growth factor alpha, stained brown here, is present in the cartilage of patients with the disease.
We've been able to see that increases at the early stages of the disease, and we can also see in other studies, both in vitro and in vivo, that this can have detrimental effects on the cartilage. And if we can therefore intervene and block this factor, then we think that we might be able to at least slow or maybe even stop the degeneration of cartilage.
He shows here what normal cartilage cells look like under a microscope. And here, the cells have been injected with the transforming growth factor protein.
Not at all like a cartilage cell should look like. And so it's actually changing the cells and changing their ability to maintain the tissue and therefore promote.
The next stage of research would be to find ways to block this protein. And because Appleton is an MD-PhD, he'll be involved directly in patient care as well as the research component.
And going from bench to bedside is absolutely the motivation of our program. We hope to very soon move forward with, as I said, working with humans and patients in the clinics.
But this program combines the training of two fairly intense careers into one, so that clinicians can understand problems that they face in patient care and go back to the laboratory and actually solve those problems themselves and bring the solutions back to the bedside.